Hello, everyone. This is Siddharth Damber from Chicago Arthritis and Regenerative Medicine. Welcome to our Wednesday live stream. It's October 21st, 2020, and excited to be here. Today, we're actually live streaming on Facebook, YouTube, Twitter, and IG. This is a technical marvel that I've been able to work this. So today I am talking about something that I see really frequently, which is hand pain. So as a clinical rheumatologist, I get referred a lot of patients for hand pains, in large part because inflammatory arthritis conditions, including rheumatoid arthritis, psoriatic arthritis, can frequently drive pain and swelling in the hands. So hand pains are a really common issue that I see. And I had a patient earlier this week where I think understanding how to evaluate hand pains can clarify some things. So, and the interesting thing is that I think hand pains they're becoming more common or more readily recognized for a few different reasons. Number one is because, the way that we all live, in the sense that we're all constantly using our hands, either on the computer, the laptop, our mobile devices, to constantly be texting and emailing and just doing kind of all of our work on the phones nowadays. It stresses our hands in different ways than what we're used to traditionally. And certainly, I think texting thumb is starting to become a really common issue. And so it's something that I see a lot of. And I think on top of that is, frankly, I'm more aware of hand issues, not only from a professional standpoint, but even personally, since I do a lot of regenerative medicine injections. You start to develop more discomfort over the thumb as well, as you're putting stress on that joint also. So hand pain's totally a very common issue, and one that I think is interesting to talk about. So in the case of the patient that came to me, he was coming in with basically a history of progressive pains in both of his hands, were really worse than both of his thumbs. And he'd had some x-rays done. He had also had some labs done, and they were both benign. And so the question was, what's going on with his hands? And so I always think of joint issues first and foremost as what's going on from an inflammation and instability standpoint. And the reason why is because that sort of sets me on a path of evaluation about how I want to look at that. There's other issues that you have to look at as well, which I'll mention, but inflammation, instability are always key. Instability is key because that is what really drives the overall degenerative process that you see in a lot of musculoskeletal conditions, including wear and tear arthritis, tendonitis, trigger finger, things like that. And so instability, you make that evaluation and call based on what are you seeing in terms of examination findings and what are you seeing on ultrasound. So on examination findings, if there's any evidence of increased mobility, laxity on exam, that can be a clue that maybe there's some instability here. If someone comes in with a history of, listen, I feel fine first thing in the morning, but as the day goes on, then as I'm using my hands more, it starts to hurt more. It's a sign of instability in that joint likely. And so that should clue you in that there may be a progressive stress issue, instability issue here. And then the last one is ultrasound. You need to be doing ultrasound. And ultrasound to look for instability is fantastic. In the case of this patient that I saw, he had x-rays that were normal and his examination was relatively normal. But on ultrasound, he had a little bit of instability, a little bit of laxity in one of his thumb joints. And to me, that is essentially diagnostic, along with the other negative testing in terms of labs and all that, that here's someone that has some early instability and degenerative process and stress developing in that joint. And when you can make that kind of call, you can then start to guide somebody in terms of how to get them on the path to getting pain relief, functional improvement, and then hopefully also preventing this from progressing. So then the other component is inflammation. So is there anything on exam, labs, or ultrasound that would indicate inflammation? So classic history symptoms or history description of inflammation in the hands would be they wake up first thing in the morning, they haven't used their hands, but the hands are more painful and swollen at that time. Classic for inflammatory findings from inflammation. If you have inflammation throughout the body, that's how that presents. It presents as inflammation first thing in the morning, most prominently. Now, you can get inflammation from instability as well, meaning if there's chronic instability, it starts to irritate the joint, the tendons, the ligaments, and then creates a sort of mild inflammation issue there. But that happens with stress on the joint as you're using it, not first thing in the morning. The other things to look for are there any labs that indicate inflammation? In this patient's case, there wasn't. And again, ultrasound. Are there any findings on ultrasound that show that there's fluid in joint, inflammation in the joint, anything else that would clue you into inflammation? And in his case, there was not. Ultrasound to me is key because it lets me go from a good physical exam that's very helpful and gives me some clues to then looking layers and layers deeper inside the body, at the tendon, at the joint, at the ligaments, and give you a more accurate sense for, is there any more definitive evidence of inflammation, soft tissue injuries, instability issues? X-rays can't give you that, and it's the reason why X-rays did not show his issue in my patient's case, because X-rays don't look at inflammation. X-rays are generally not so great at looking for instability because of how they take the X-rays. If you only take a static X-ray, and that means you take your hand and you just take a shot of that, then that's a static image. It doesn't show instability. On the other hand, if you took a shot of your thumb moving, you might be able to find instability. And they don't routinely do that when it comes to X-ray imaging. Ultrasound imaging, on the other hand, you can routinely do that because it's right at the bedside. It's easy to do. You tell the patient to either lay still and you move the joint, or you tell them to move the joint, and you can find the instability. So to me, ultrasound is key because the example would be if you came into a doctor saying you were short of breath, and the doctor said, well, you look like you're breathing okay. And he didn't, and he or she didn't even listen to your chest for your lungs or your heart. Like, that would be crazy. And for musculoskeletal medicine, you need to use ultrasound in order to really properly look at what's going on underneath the skin. So to me, that's how you look at inflammation, instability. Where's the evidence of one or the other that kind of guides me on the path for what's the next step. Now, there are definitely other things that can cause issues. Let's say if you have a pinched nerve, so you need to make sure you're looking at the wrist, the elbow, the neck. Is there any other evidence of where someone could be having pain from another source? Absolutely. But from a initial evaluation, inflammation, instability, really the first way to evaluate someone who's got hand pains. In this patient's case that I'm describing, he has instability of his thumb joints on both sides, likely due to his job as a software engineer, that's causing stress and pain in both of his thumbs. And we talked about a strategy for him involving initially some very basic things, working with a hand therapist, some over-the-counter supplements. If it's not enough, then likely escalating to platelet-rich plasma, where we could then treat not only the joint that's unstable, but also the ligaments to improve stability there as well. So hand pains, really common thing that I see. I think something that we're going to see a lot more of based on how we're actually living as humans nowadays on our mobile devices. And if you have a hand issue, that's the right way to pursue it. Make sure you're getting evaluated for both inflammation and instability, as well as figuring out if you may have a nerve-related issue that could be causing hand pains as well. Make sure you're getting a diagnostic musculoskeletal ultrasound as well. That'll get you on the right path to a diagnosis and then eventually treatment. Wonderful. So as a reminder, we do this live stream twice per week, Mondays and Wednesdays around 12:30 Central Standard Time. In addition, I'm doing a webinar today, 4 p.m. Central Standard Time, on regenerative medicine treatments for shoulder pain. If you've got a rotator cuff issue, shoulder arthritis, or just a shoulder strain, I think this webinar would be very helpful to listen into. I'll actually be live streaming that on Facebook, Twitter, and YouTube as well. And until we talk again, have a good day and live well. Goodbye.